Welcome to Kaufman's first Life Science Ventures Summit. For those of you that don't know me, I'm Dominique Pahud with the Kaufman Foundation. I'm a director in our Innovations and Networks group. I spend a lot of time thinking about healthcare and life sciences. And I'll be your MC over the next few days. The Kaufman Foundation decided to put together this event because we felt there was a really strong unmet need around commercialization education in the early stage. And we, as a foundation of entrepreneurship, our mission is to make sure that as many of you go out there, start businesses, grow them, and eventually deliver products to the market. And in this particular case, the patient. We were very ambitious in putting this event together, and that is a really broad cast of characters we have assembled here. So we're defining life sciences very, very broadly. So we're including digital health, medical devices, diagnostics, and therapeutics. We acknowledge that these worlds are quite different in terms of how you develop successfully a product, but we felt there was a great opportunity for you to learn from each other and borrow from each other in terms of ideas and problem solve. At the end of the day, we're all here together under one common purpose, which is to serve the patient. Obviously, putting such an ambitious event together is not possible by ourselves, so we reach out to our colleagues and friends to help us to attract the talent and the right people to this event. So I would like to acknowledge our friends and colleagues from UC's QB3, our hosts here today, Stanford's Biodesign, MIT's Hacking Medicine, and Rock Health. So the topics and the curriculum you'll see over the next few days are really informed by you. I mean, even though we do a lot of work in entrepreneurship, obviously, and have a good sense of what's happening in the environment, we felt it was really important to reach out to you and really understand what you're struggling with, what in today's world, what are the unmet needs in terms of education, and understanding what are the big hurdles you need to overcome. So we did a bunch of surveys and research, reached out to entrepreneurs and serial entrepreneurs to ask the questions of what would you like to learn more about, how, when, etc. And that was really what informed the curriculum over the next couple of days. One thing you'll notice is a lot of break time through this event, and that was on purpose. One of the things that came out loud and clear from you was, hey, we really want to meet with our peers. We highly value networking, so this is your opportunity. Don't be shy. Anybody here in the room is more of an introvert? I am. Not comfortable speaking in public or talking to strangers. I really strongly challenge you to just do it anyways. The chances are, if you introduce yourself to a stranger, you're going to meet someone really amazing. There's really a highly talented, very interesting group of individuals here today. So just get out of your comfort zone and introduce yourself, and I think you'll really appreciate it after the fact. A couple of things. We had initially our colleagues from the FDA, Steven Spielberg, come and talk to us on Saturday, but because of a family emergency, he cannot be with us today. But we have another session that we'll be talking about collaborations and partnerships, and they'll be showcasing a lot of your colleagues, entrepreneurs. I think that will really speak to something that's very important, which is collaborations and partnerships in today's environment. So my hope, what I hope you can walk away from over the next couple of days, I really hope that you have a better appreciation of what the journey is ahead, what it will take for you to be successful in this environment, and that you will be able to engage at a higher level with your community and your peers. You'll understand the language better, you'll understand the obstacles, and when you have that time, you will be able to engage in a more thoughtful, useful way. The other thing, my biggest hope really is that you actually meet some great people here. That this is a start of many great relationships of peers that will help you in the lows, and then you will help them in their lows and in the highs as well. And this is something that I think will potentially help you the most from all the things you'll see and hear from today over the next couple of days. So previously, I mentioned about how today's environment is really tough because of regulatory and funding obstacles, and why we felt there was a need to help you step up and provide some content to help you overcome some of these big questions and challenges. And one could argue that one of the toughest areas in life sciences is diagnostics. So I really feel that when things get really, really tough, this is when the stars shine in terms of the creativity around problem solving and being creative about how to find solutions. So this is why I've asked Kim Popovits, the CEO of Genomic Health, to come and talk to us. She is a former Genentech alum like myself, and she will be here with us and sharing her perspective on how to approach your journey as an entrepreneur and what you need to consider, at least consider in order to be successful in today's environment. So please welcome me in welcoming Kim Popovits. Thank you.
So my goal this morning would be, and by the way, I don't mind questions as I speak, so please jump in if you care to, would be really to look at some of the things that we encountered along the way, both things that we planned, but things that we didn't plan. And often when I say to folks, when I made the decision to leave Genentech to start Genomic Health with some amazing colleagues, one of the things that folks said to me, my dear friends at Genentech, whose opinions I greatly valued, some of the feedback I got was, boy, that's pretty risky. Sounds like a great idea, but doesn't seem like that's going to happen for maybe 10 or 20 years. How are you ever going to get it paid for? I don't understand the business model. And I remember taking all of that sage advice and thinking, just making notes in my head of, okay, those are all the questions that we're going to have to answer. And I didn't know the answers at the time. And, was there some trepidation in going to do this? Absolutely. I remember one of my first days when I eventually got to Genomic Health, and I was sitting at my desk, and there wasn't a single email on my screen, which was just bizarre, right? I hadn't seen that in 25 years, so. And I'm looking down this lovely tree-lined street in this little tiny office, and I was scratching my head and thinking, oh my God, what have I done? How are we going to build this business? And so I think some of what I'll tell you today is having the confidence in yourself to take some risk, not necessarily being afraid of failing, because we all know when we fail, we learn. And if you're with the right team of people and you're coalesced around a shared purpose and passion, you can make amazing things happen. And I'll give you some tips of things that we did to make sure that we had that maniacal focus over the 12-year period, because day one, if somebody had said, it's going to take you, 3 to 5 years to launch a product, that didn't seem so bad, because in, the drug world, that's 10 years if you're lucky, right? And most of them fail. So I said 3 to 5 years. Development cycle is pretty good. At the time, though, if somebody had said it's going to take you another 3 years to get anybody to pay for your product, I would have thought that's just not a viable business model. We won't survive that. And so I'll tell you how we did, because that is in fact what happened. And just backing up here, that my comment there about novel ideas aren't enough. I think there probably was a day that you could walk into, a VC's firm and say, okay, I've got this amazing, brilliant idea, and everybody's really psyched because you're super smart, and that's a great idea, and in fact, there is even a need for it. I think today it's different. I think you have to demonstrate the sustainability piece of it. You have to demonstrate, when can you achieve profitability. So the big idea, while important, isn't enough to attract the kind of investment that you'll need to get through or extend your runway long enough to get to profitability in building your business. So just my comments that I'll make around Genomic Health's business, of course, are maybe forward-looking, so I would refer everybody to our SEC filings. So for those of you that don't know Genomic Health well, and again, I don't want to get into a deep company presentation, but I think helpful for you to understand our product, because this was our big idea. So as we sat there, and the three of us from our team that came from the drug development world, all from Genentech, and the fourth member was Randy Scott, that came from more of the sequencing of the genome world. So he had been immersed in the data and in the whole race to sequence the first human genome. And Randy's thought was, boy, it's really unfortunate that we've got all of this data in sequencing genomes, and at the time, forget what it cost to do that, but basically the concept that we were going to be able to do that, but yet we weren't really using that data to inform patients better about how to treat their disease. So we had all this data, but nobody had turned it into information, and he said, we got to be able to do that, and so he had this idea of doing it from the diagnostic side of it. So if we could go back in time and take tissue that had been locked up in tumor blocks in banks across our country, could we start to use those tissues, those tumors, to make predictions and look at patient outcomes and hopefully diagnose their disease better and help them pick a better treatment starting out. And so we focus specifically on cancer. And so that's a point that I think is really important. You need to figure out, what you're going to do and where you're going to focus. So when I joined the group and they had figured out scientifically how to do what they wanted to do, the question was then, well, what do we do? Do we do cardiovascular work? Do we do immunology? Do we do cancer? So we had a bit of a bent towards cancer from our experience at Genentech and our experience in launching a couple of antibodies at Genentech that required specifically HER2, a diagnostic test to go with them. So I remember that first meeting where we had $50 million that we had raised, but we had, I think, about 15 ideas on the table. And so, my role at the time was, okay, guys, these are great ideas, but we have $50 million in a relatively short period of time to turn this into a business. We can't do 15 things. Which one are we going to pick? And that comes into doing some, reasonably good market research. And I say market research not to the tune of spending $500,000 on market research, but just going out and asking oncologists, what are your biggest needs? And clearly for us, it came back, we don't know what to do with these early stage breast cancer patients. There's 240,000 of them diagnosed a year. Most of them will do fine. Their disease isn't going to recur over a 10-year period. The problem is we tell patients they have cancer and they want to be aggressive. And then we offer most of them chemotherapy. And the data that you see here in the middle of the slide that we know is less than 4% of patients actually benefit from chemotherapy. Now, that's a surprising statistic to a lot of folks, but 1 in 4. So early stage breast cancer and the same in early stage colon cancer, 1 in 4 actually get any benefit from chemo. So we all know somebody who's had chemotherapy, they've suffered all of the side effects, the obvious ones that we see, hair loss and nausea and all, but there are lifelong side effects from chemotherapy that are significant that we really need to look at, not to mention the cost to the healthcare system. So that was our big conflict. So I say here, start with a conflict. A conflict that we have 1.6 million new cancers diagnosed a year. Start with the conflict that we know in cancer therapeutics, the efficacy rate's about 25%. So across all of the drugs used in cancer, about 25% efficacy rate. And we know that in 2012, we're going to spend about $80 billion on those drugs. And that's just the drugs, not everything else that goes along with treating cancer. So you do that math, you've got $60 billion worth of waste. Well, how could we possibly direct that $60 billion in another direction that could help us, use our healthcare resources better? And our feeling was it's diagnostics. If you don't focus on diagnosing disease up front better, we can't fix this problem. And so that was our conflict that we presented, and we said, okay, if you start in breast cancer, this value proposition here for these 240,000, or it's actually about 100,000 that are diagnosed early stage, if we could build a test that could tell those women upon diagnosis that your cancer is really not very aggressive, and furthermore, we can tell you that you don't have the type of cancer that's going to benefit from chemotherapy, then boy, what a great value proposition. But what we had to demonstrate, so here's lesson number 1. We built the test, we had the data, and data, you all know that. But it wasn't enough because when we got into the marketplace with our test, what did we hear from payers? Well, that's great. You're right, chemotherapy is really expensive. We didn't have to sell people on the idea that cancer was overtreated. They knew that. But what they thought was that we're going to use your test, and when we launched it, it was a $3,500 test, unheard of in diagnostics, right? And say, we're going to use your test, but nothing is going to change. Everybody's going to keep giving chemotherapy because they've been doing that for decades, and that's standard of care, and you're not going to be able to change behavior. So what we failed to do when we did our early studies and validation was think about proving that there would be some change in behavior if, in fact, our test was adopted. So the next couple of years, what we did is we undertook many what we call decision impact studies, both in the United States, and then we followed them on with decision impact work outside the United States, and found that on average, treatment decisions were changing 37% of the time when the recurrence score of the test was used for breast cancer patients to make their decision around whether or not they got chemotherapy. And it works in both directions. Some will say, I didn't want to get chemo. I got a recurrence score and realized I had high-risk disease. I got chemo. It's mostly the other way, though. Most patients that would have gotten chemo based on the traditional guidelines and what was standard of care get the recurrence score and decide I don't need chemotherapy, and they choose a different course of treatment. So that was the value proposition that we had to then go and prove. So when I talk about making sure that you have data, you've got the clinical validation data, but that you're able to show what value you're delivering and that you measure it so that payers can look at it. I put this slide in because, and I'll talk a little bit more about this later, I think it's so important. Dominic said it when he started his talk and he ended with it. You know, what we're all about is really doing things for patients. You know, it's making the world better, it's helping cancer patients, it's helping patients with all diseases. And at our company, we never lose sight of this. You know, at the core of everything we do at Genomic Health, there's a patient. When we run into tough decisions, there's always somebody in the room that will say, well, what's in the best interest of patients? It always helps you figure out which direction to go. Sometimes you can lose sight of that, especially when you're a new company and you're raising money and you're just getting started and it's all about, we've got to be successful, it's the numbers, you know, and it's before you even get to it's about Wall Street. You know, you're at a point of just, we got to survive. But it really is about the patient at the end of the day. Diane's story is a really neat one because she's a commercial airline pilot and she flew a flight into New York just several years ago. And when she landed, she got a text message from her doctor's office that, you know, you need to call right away. She had had a biopsy the week before, so they told her that she had breast cancer. Pretty devastating news. And so per protocol, she had to call her airline, her employer, and share this news with them. So that's just kind of the rule. If you have any significant happening in your life and you're in the middle of flying, you need to report it. Well, they immediately told her, you cannot fly the plane back. You're going to have to go back as a passenger, and we'll see what's next. And so she got to her physician's office, and they said, you know, we want you to get chemotherapy. And she said, well, if I do, I'm going to lose my career. I mean, this isn't about just, you know, the other side effects. I will likely lose my commercial pilot's license. So the doctor, fortunately at that time, knew about our test and said, well, there's a new test, and let's get it done. And if you have a low recurrence score, I'll be comfortable not giving you chemo, but if you have a high recurrence score, I'm going to insist that you get chemotherapy. She had the test, and she had a recurrence score of 13, so Diane would tell you it's her lucky number now, and that is a low recurrence score. She didn't have to get chemotherapy. She's still flying. She would also tell you that the bonus, although she said, I would hate to sound so vain, but that ponytail you see there is something she'd been growing for like 40 years and you know, definitely didn't want to lose that. But it's a great example of, you know, when you talk about the value proposition, the story that we had to talk about was you save people's careers, you improve their quality of life, you eliminate a very expensive and toxic treatment. You demonstrate to payers that, in fact, treatment decisions will change. But all of that had to happen beyond the big idea, right? So just getting out there to say, this makes sense, and people look at you and nod and say, I get it, but prove to me that things will actually change with this, that we will change standard of care or whatever the business you're in. What are you changing? The other thing that I think when we did our IPO was hugely important. One was demonstrating that we could gain reimbursement, of course, because we had to build a financially successful business. The other was just demonstrating sustainability. So then you say, okay, I've got the big idea, I've demonstrated that it can deliver value, and everybody's going to look at you and say, well, what's next? So after you do that, what are your other ideas? What's in your pipeline? And, you know, in our world, because it was a new field in terms of molecular diagnostics, it wasn't that people just understood you're a drug company and there must be other molecules in your development program and we can look at those later. It became more important because we were launching a relatively new business model, that what comes after this then? How do you take this one test for early stage breast cancer and make it mean something more in the future? So what you see here is over the last 6 or 7 years, the number of different, what I would say, launches that we've had in terms of information for breast cancer patients. We've moved into colon cancer. We've moved into other areas of breast cancer. And the program that we're working on right now, in fact, with UCSF, is a prostate cancer program, which is a huge market. And I'll share with you our considerations in going into prostate cancer here in just a minute. So, you know, the idea here is that you can't ever stop. You've got to constantly innovate. You've got to constantly demonstrate that you're thinking about what you're going to bring behind this, which is hard sometimes when you're early stage because you've got enough on your plate just thinking about getting this one idea you have forward. So the other thing is setting clear expectations. So you talk to your investors, and whether it's the VC world or angel money, or whether even Wall Street as you're a public company, you know, what expectations are you setting? Now, anybody that, you know, has ever built a business, this is the kind of revenue curve you want, right? So we always say up and to the right looks good. Doesn't always happen, but I think what you say, and not that curve's that steep, but letting people know what are you expecting? When we did our IPO, and I remember we got some funny looks on occasion when we said, if you are looking for a short-term investment, a short-term turnaround, if your expectations are to turn 10x in the next 3 to 5 years, please don't invest in our company because we're going to disappoint you. So what we did was we were very clear about how much we thought we would need, how much runway we would need, and how we thought our revenues would grow over time, very transparent with our shareholders and our investors. And I think that sometimes you're delivering news that maybe they all don't want to hear, and you'll stop some people from investing because of that. But up front, you want to get the right investors. You get the wrong investors, and your business model could fail simply because you have the wrong investors that don't share your long-term vision, that don't understand your value proposition, and are not aligned with your values and how you're going to run your business. So I think sometimes it's easy if somebody steps up and says, wow, I just got this, somebody just came to me and we're going to get $5 million or $10 or $20 million. It's hard to not sit back and say, is that money I want? Especially in this day and age when it's getting harder and harder. But you really do need to think about that, because those people are going to be on your board, guiding your decisions, having input. So sometimes be careful what you wish for. But one thing I think that we were very transparent about was saying, this is what we think we can deliver. These are milestones, very clear about what the milestones were, how we were going to do it, always reporting our progress on those. And this is something that we continue today, 12 years into it, to have to deal with. When will you be profitable? When can you turn a profit? You've got a lot of pressure to turn a profit. So that's a little bit in conflict with that pipeline I just showed you. So you want a profit, but yet you want to keep investing in the ideas coming behind the one that you just launched. So, what we said with profitability, we set out a goal to have the company be profitable in 2010, and we achieved that. So then we had to step in and say, okay, we've achieved profitability. Well, what happens? Everybody starts to run away with, oh, great, they're profitable. They're going to start returning profits to shareholders. They're going to keep growing profits. And they start to change their story about Genomic Health. And we had to step in and say, no. We want to be clear on what we're intending to do next. This move to profitability was a great celebration for the company. We were to a point here that we were a self-sustaining business, so everything that we were doing in research and development we could pay for ourselves, that we would perhaps deliver a little bit more profit in subsequent years, but our goal wasn't going to be to grow profits. So we said, we've got this amazing pipeline. We have a test in colon cancer that we're developing. We want to move into prostate cancer. And until we get through the prostate cancer launch and reimbursement for that test, we don't think we will be, wildly growing profits, because we intend to keep investing in our business. That's different for diagnostics. So the amount of revenue that we at Genomic Health invest back into our business is unheard of in the diagnostics world. So that was another thing that we had to get people used to. Diagnostic companies typically don't have very large R&D investments. We do. That's just the nature of our business and our business model. So we had to both educate the world that, no, we're going to be putting this money back into our pipeline, and tell them over and over and over again. And you're going to see probably over-communicate several times in my slides here today, because that just is so important. Over-communicating with your investors, over-communicating with your employees. If you think you've said it once and people are smart and they get it, just know they do not. And sometimes I feel like a broken record, but you just have to continue to figure out be very clear. Here are our milestones, here are the expectations, this is what we plan to deliver, this is when, and say it over and over and over again. So, the other thing and this is wonderful because this is what you're doing here today, but networking. We have purposefully chosen to set up our clinical studies and our collaborators with really, really good networks. The NCI, USCF, NSABP, all of the major cancer groups, academic centers. So who you choose to partner with, who you choose to do your scientific work with, really, really matters. So if it means that you're slowing down your timeline to pick a better collaborator, to pick a better key opinion leader, as we say in our world, to work with, it's probably worth it. I mean, you have to always weigh that. But in the end, when you have data that has been driven by, ECOG and SWOG and the National Cancer Institute and UCSF or Memorial Sloan Kettering, that's data that is going to take you farther, faster in the marketplace as you move into the commercial world. keeping ahead of the curve, constantly innovating, constantly adding value to your core business. So we started out in breast cancer with early stage breast cancer. We quickly moved into colon cancer, but we never took our eye off of the core business of breast cancer and said, this is a customer we have. So you've seen businesses where businesses will capture a customer segment, and then they have another big idea and they move on to a new customer segment. And we forget about, wait a second, we already have this customer. There's 10,000 treating breast cancer oncologists and surgeons that interact with Genomic Health every year. What could we be doing for them more than our initial early stage breast cancer test? So you've already got a customer in hand. Is there another product that you're going to give to that same customer, or do you think it's easier to go out and attract a whole new group of customers? Of course not. So one of the things that we've done along the way with breast cancer, because there's a significant need there for patients, is the initial test, which this is our initial, our initial report looks very much like this one. Our initial report for that early stage breast cancer patient was a one-page report. I think it's now 4 or 5 pages. So over the last 8 years, what we've done, we haven't changed the price, but what we've done is we continue to add value to that first product. So what are we doing? We're giving more value to customers, we're helping more patients, but most importantly, we've established a pretty high competitive barrier. So for companies that saw Genomic Health gain a lot of traction in the early stage breast cancer market and said, wow, okay, that's a 21 gene assay, we could do that, we could do a study, but by the time we get that study done, Genomic Health's 21 gene assay now isn't just answering a question around breast cancer recurrence and chemotherapy benefit. They're talking about node-positive patients, they're talking about DCIS, which is an earlier stage breast cancer, they're talking about giving single gene scores to all of these patients. So now all of a sudden that one-page simple report became a lot more complex and built a nice competitive barrier for us. So don't ever take your eye off of your core business and ways to continue to innovate for the customers that you have today. And of course you want to build new customers for the future, but this is your bread and butter, and this is where you should continue to innovate as they are existing customers. So that brings me to then, how do you decide when and if to go into new markets? Prostate cancer, a huge need, complicated one, and it represented some challenges that breast cancer and colon cancer did not. Now you might think, well, it's pretty obvious, right? Why wouldn't Genomic Health go into prostate cancer? It's a cancer, their core business is cancer. But recall, our core business today is breast cancer and getting reimbursement in breast cancer, and we just added on colon. So prostate cancer, yeah, it fits the core mission of helping cancer patients. It fits our core mission in terms of the type of work that we're doing. It represented some challenges clinically that we hadn't had to conquer with breast and colon cancer, so we knew those would take some time, and it probably, well, actually took about 2 years to figure those things out. The other thing with prostate cancer that we had to take a look at, no question the market is huge, but what would you need to do to change decisions in prostate cancer? So the issue in prostate cancer, 90% of men diagnosed with prostate cancer should probably do nothing. They get a biopsy, they should probably just watch it and monitor that disease. What's happening today is that 90% though are actually getting pretty aggressive treatment with some pretty significant quality of life issues. It's not a chemotherapy decision, it's a radiation and surgery decision, both costly, but both end up with pretty life debilitating side effects. So again though, what questions would you have to answer in prostate cancer for men, for physicians to feel comfortable saying, I'm not worried about this cancer. It's not going to kill you, something else will first. But we've got to give them the right evidence so that they feel comfortable doing that, because the fact of the matter is standard of care today isn't working that way. So figuring out which questions to answer, where do you go to get the clinical samples and the studies to do the work? How do you resolve the issue around working with core biopsies? So there are a lot of complications with prostate cancer. No question the market was huge. And for us, an additional consideration for it is it will require us to build a sales force for prostate. So this is a urology business more than it is an oncology business. We're certainly not going to take the same sales force and have them do both. So we have to look at what is the infrastructure cost of building a new commercial piece for it. And then what part of our commercial infrastructure today can we leverage here, which is a positive thing, right? So we're leveraging it across now 3 cancers instead of 2. When I tell you the infrastructure that we built commercially, if somebody had asked me 12 years ago, and my background was on the commercial side, Kim, what sort of commercial infrastructure do you think you're going to need to build to launch your first diagnostic test? I wouldn't have come close to estimating what we ended up building, and I can show you some of those numbers in just a minute. So again, looking at new markets, just be careful about what you're asking yourself to build or take on from a resource standpoint in doing so. This slide, you look at a $3.5 billion opportunity just across the 3 cancers that we're focused in. Significant opportunity, we'll do, on the order of $240 million in revenue this year, so barely scratching the surface, so that's great. How are you going to tap that? But more importantly, I just wanted to plant the seed for the global opportunity. You should be thinking about how do you address a global market, and that's something that was also different in diagnostics. I never quite thought about it this way, but the diagnostic world isn't a global one. So if you think about diagnostic companies like LabCorp and Quest, they're not global businesses. So we had to decide early on, do we want to capture this opportunity? Well, who wouldn't, right? So do you want to license this out? Do you want to keep it within? How are you going to handle that? We made the decision that we wanted to clear what we thought were going to be the big barriers in the U.S. first and learn from those before we expanded ourselves internationally because, of course, the resource investment that we knew we'd need to make. And so for us, it was, let's get through profitability. Let's demonstrate we have more than one product. Let's demonstrate that we can continue to add value to the breast cancer test. Let's demonstrate that we've got good competitive barrier set. And then we can think about going, to a global market, which we are now doing. So we are one of probably the first diagnostics companies that has actually taken a business globally. And today we receive breast cancer tissue from 60 to 70 countries around the world, right here in Redwood City, right down the street. So it's been successful, but a lot more work to do there. And you've got the same issues. It took us 3 years to get reimbursement in the United States. It's probably going to take us that long to get reimbursement in the major countries in Europe and Asia. And we're slowly, but definitely seeing some success there. The other thing, just briefly, staying ahead of a curve in terms of innovation, and this gets back to, we have a test in the marketplace that is operating today on a platform that will continue to operate on for a while. But we've all seen all of the press around next generation sequencing and how are you going to use that. Now, we don't move to new technology just because it's cool. You move to new technology, and we are a technology agnostic company, but you move there when it can do something better for your future, for the products that you have. So we, moved rather quickly to the next generation sequencing platforms in research and development because it allows us to see the biology of cancer better. So again, you tie that back to how does that help you with your business? Well, we're trying to help cancer patients. If we have tools that can help us see the biology of the disease better, it makes sense that we ought to be using those in our research and development work. So in fact, we are doing that and have been doing that for almost 3 years now, and also forming additional strategic alliances and looking for future cancer products that we can build with collaborators. So we're at a point now that I think moving forward, we have a lot going on in research and development that is actually very different than what research and development looked like 10 years ago when we were using the platform we did to develop the tests we have. But the test we have isn't changing, so you have to still think about in the commercial world that we move on status quo with the tests that we have. Not to bog you down with a lot of detail here, but the point is, I mentioned a second ago, competitive barriers. How do you establish those? Well, I think some of it gets established over time by the work that you do, but you should be consciously thinking about the work that you're doing, the validation studies, the commercial effort, the sales force you're building, the partners that you're networking with. How do all those start to stack up as competitive barriers? And so when I went back to our team and said, okay, just tell me across these 4 pillars, which I think are the 4 pillars of the foundation of our company, what are we doing there that's so significant? Well, how does that create a barrier of entry? Well, in the diagnostics field, especially I think this patient access and the global piece, significant barriers in terms of what it costs to enter the game. And I don't think there are a lot of shortcuts in our world. Data reigns king. It did 10 years ago, and it does today, especially when you're looking to change standard of care and treatment decisions in cancer. But if you look across there, the investment that we've made has been significant, certainly more than we had intended starting out. The fact that we were able to do it in a very measured way, I think, had very senior folks that had been through some ups and downs in other companies, so managing our resources pretty carefully, not growing too fast, not getting too far over our skis, as I always say, was critical in being able to reach this point where we have become a self-sustaining business and, one that is, growing revenue each year. And I'm, moving. I'll be done here in just a second. But this slide, I could probably could have spent the whole 30 minutes on it, and you all would have said, "Oh my goodness, really." Building a healthy organization, and healthy is the key word here. There's been a lot of work done. In fact, I just recently read a wonderful business book, and some of which some of this is from. It's called The Advantage by Patrick Lencioni. If you read one business book this year, that's the book I would read, and I read a lot. And the reason for it, just very pragmatic advice on how to build a company, to build clarity within your company, not just for your employees, but for your investors, to get really clear on what your strategic initiatives are, hiring the right people, caring about the health of your organization. Smart just isn't enough. I stand up in front of I did it this week. We had a very senior level group together and said, we don't need more smart here. We got smart everywhere I look in our company. And it's wonderful because every meeting I'm in, I'm stimulated, I'm constantly learning. It's like you walk out and think, these people are brilliant. That's great. And especially when you're small, that's what you want, right? You're going to bring like 5 brilliant people together that really know what they do well. But as you grow, smart becomes less important. Although I will say, if there's table stakes, right? There's got to be some bar there. So you establish what that bar is. But beyond that, it's really about building a healthy culture. It's about building a healthy company because smart will not create healthy, but healthy will make you smarter. And when you're bringing out the best, the data on how much is left on the table at the end of the day in most companies because we don't leverage our people well, because we're not healthy, is staggering. I mean, it's just amazing the capacity that you can get just by leveraging your current asset, your resources of the people that are there. But what do companies do? They start to go hire more, right? So let's just hire more people to get the work done. No, how about if we just get more out of the people that are there? And that doesn't mean working longer hours. It means creating a healthy environment, where there's candor and where ideas come forward and where people feel comfortable sharing their opinions with one another in a healthy way. So again, I would highly recommend reading Lencioni's book because I think there's enough data in there that you couldn't walk away from and think that this piece doesn't matter. And hiring, when you think about the hiring decision, I recently read something, and actually it makes sense to me, but generally in an interview, the interviewer makes a decision on whether or not they're going to hire somebody within about 10 minutes. So you've got an hour-long interview, and in the first 10 minutes, in your mind, you've decided whether or not this person is going to be hired or not. So if that person doesn't work out, how long does it take you to get that person moved out of the organization? It's 2 years. On average, 2 years. So you make the decision in 10 minutes, you undo it over a 2-year period, and what happens over the 2-year period? Lost productivity, lost morale, swirling on teams, decisions don't get made, you've got an unhappy person. So, I just can't emphasize enough, be really, really, really picky about who you bring onto your team. And smart's not enough. You can have a brilliant person that will absolutely wreak havoc among your organization and your team. And once that starts to happen, you have a problem. And so I'm very fond of the phrase one. And in our company, you're not a biostatistician if you're a leader in our company, and you're not the chief medical officer. We're one. We do it all. We're all responsible for it all. And if you don't work together as a team that way, you'll never get the most productivity out of your people. So again, I feel compelled to say I think that's one of the things that we focus on the most today at Genomic Health, and it's really hard to get individuals that were once individual contributors that came with a core competency to think that part of their job is to focus on developing the future, leading others, building a succession plan. That almost seems like the stuff you should read about on the weekend. It's not my day job, it is your day job. If you're a leader, and everybody in here, by nature of being here, you will be a CEO, you will be a founder, you will be that. It is your job not to just build the product, but to build the company and build a healthy environment and lead it. And I think that's just essential to be competitive today. And then also to reward collective ownership and really celebrate those successes. Know what the prize is. Do the people around you and on your teams, do they know what winning even looks like? It struck me last week when Matt Cain pitched that perfect game and everybody came flying out of the dugout and tackled him. I thought, God, that's just awesome. You're sitting there in your living room, you got goosebumps. And I sat there later and thought, I wonder if everybody at Genomic Health would know what pitching the perfect game looks like. Would they know what those 4 criteria are to say we won? Would our managers know when to run out of the dugout and tackle the pitcher and know that everybody else on the field had a role in that and everybody else could celebrate equally? And if you can't answer that question, then you really haven't built a healthy environment. So I actually went back to work the next day and happened to have a team meeting. I said, I just want to know, you guys, what would you say our perfect game is? What kinds of things, and then how are we celebrating that? Really easy, because we're all driven to just keep going on to the next project, the next work, whatever. But take time to be clear on what you're celebrating and do it. My final slide here, but just again, over communicating and having a clear, sustainable, very key mission. 3 circles from Jim Collins' work. I don't know if you guys have read any of Jim Collins' work, but he's got this hedgehog kind of concept, and we embraced it 12 years ago. So we put these 3 circles together 12 years ago with those words in them, and they've not changed over 12 years. So when I talk about, if you walked down the hallway at Genomic Health and asked anybody what our mission was, what do we want to be the best in the world at, they would be able to recite this. And it's showed at every meeting. And along with a set of core values that we established. Now, we don't put our core values up on slides and up on walls. I don't believe in doing that. If you can't live them, if you can't feel them in the environment, it's not going to help you if you paste them on somebody's door, right? You just do it or you don't. But it's important that you establish core values, that you hold people accountable to those values and their behaviors accountable. But you are just absolutely maniacal about why are we here? What are we doing? And if somebody can't say, we're here because we're trying to help cancer patients make more informed decisions. We're changing the world by changing the face of cancer treatment, then how can their work be meaningful if they're pipetting all day long or if they're they're in the accessioning department. So really establishing why. It's, just think about it as the why. Why are we here is really important especially for your employees, but I think also for your shareholders and investors. So with that, I'm a little bit over, so I apologize for that, but I thank everybody and have a wonderful meeting. Continue to network, and best of luck with all of your big ideas.